It is the ultimate physiological crisis. In a single moment, the rhythm of life stops. But what actually happens inside the body when the heart ceases to pump? To understand the stop, we must distinguish between a heart attack, a plumbing problem, and sudden cardiac arrest, which is an electrical failure that shuts everything down instantly. Normally, your sinus node acts as a natural pacemaker, sending electrical signals that tell the heart muscles to contract. When this signal is interrupted, the mechanical pumping stops immediately. Within seconds of the heart stopping, blood pressure drops to zero. The brain, which consumes 20% of your body's oxygen, is the first to react. You lose consciousness almost instantly. Without fresh blood, the brain's oxygen reserves are depleted in about 10 seconds. Electrical activity in the cerebral cortex begins to fade, leading to a state of clinical death. You may see agonal breathing, short, labored gasps. This isn't true breathing, it's a brainstem reflex, a desperate final attempt by the body to bring in oxygen. At the microscopic level, the disaster deepens. Without oxygen, cells cannot produce energy. They begin to break down, releasing toxins that damage surrounding tissue. The 4-minute mark is a critical threshold. This is when permanent brain damage begins. Every minute that passes without blood flow reduces the chance of survival by 10%. This is where CPR becomes vital. By compressing the chest, you are physically squeezing the heart, manually forcing blood to the brain to keep those cells alive. If the heart is in a state of ventricular fibrillation or chaotic quivering, an AED can deliver a shock. This isn't starting the heart, but resetting it to let the natural rhythm take over. In the hospital, doctors use medications like epinephrine to increase blood pressure and improve the chances of ROSC, the return of spontaneous circulation. Sometimes doctors intentionally cool the body down. This slowed metabolism protects the brain from further damage, while the heart recovers its strength. Why does the heart stop? The most common cause is coronary artery disease, where a lack of blood flow to the heart muscle itself triggers an electrical short circuit. In younger people, the cause is often genetic, such as an enlarged heart or an undiagnosed electrical abnormality, like long QT syndrome. When a heart stops, the clock is the enemy. But with immediate CPR and a quick shock from an AED, life can be restored. You are the first link in that chain. The heart is a resilient engine, but it needs help when it stalls. Knowledge and fast action are the only things that can bring a stopped heart back to life.